Also happening at the State House today, a coalition of healthcare providers and advocacy organizations gathered to launch a new campaign called Who Will Care?
Back in 1995, Maine had more than 130 nursing homes. Today, there are only about 80 left. Backers of this campaign say low reimbursement rates for long-term care centers are to blame. News Center Maine's Sam Olson shows us why the effort has support from leaders in each political party.
Something must be done.
These healthcare professionals are asking our state's leaders for help, as many long-term care organizations are struggling to provide that care to older Mainers. The new coalition says 23 nursing homes have closed across Maine in the past decade, while existing facilities are facing a $120 million reimbursement shortfall.
These preventable closures cause significant emotional distress to our residents and Maine families.
The coalition met at the State House this morning seeking more help from lawmakers. Backers of the campaign, including Senate President Troy Jackson, say right now the governor's supplemental budget allocates only $3 million to help the long-term care system. The coalition is now asking for nearly $30 million more.
We have patients who have been in the hospital for over 4 months awaiting placements in facilities.
Advocates say the system is at the brink of collapse, and if more funding isn't provided, Maine will see more long-term care centers close in the near future.
Long-term care facilities have seen costs soar while their revenue streams have lagged behind.
On top of that, nurses who work in these facilities say they're physically and emotionally drained. As providers try to recruit and retain workers, simply raising wages isn't enough.
They've raised wages over 30% in the last 3 years, and unfortunately, those agencies just continue to raise their rates. It's this never-ending cycle.
A cycle the long-term care system can't break, the coalition says, until they get more support from the state. In Augusta, Sam Olson, News Center, Maine.
We reached out to the governor's administration for comment. They referred us to the Department of Health and Human Services. A spokesperson said the well-being of those who live and work in these facilities is important. The agency is planning to invest $50 million into nursing home reimbursements as part of rate reform for the next fiscal year. The department says that money will incentivize workforce and promote quality.